Well, hey everyone, my name is Dr. David Alper, and I'm here once again with the weightofmyheart.org's footnotes. And today we're going to talk about dry, cracking skin on the bottoms of the feet. Why are we talking about dry, cracking skin? Well, first of all, it hurts. But the real problem is that very often the treatments that people give at home are worse than the problem itself. So what's important to know is with most things of the proper things to do and to not do. The reason that the skin cracks so much is that when circulation is poor from PAD or diabetes, the moisture does not get to the skin on the inside. And that means you need to moisturize it on the outside. But first you need to prepare the skin. What you don't want to prepare the skin with is something like this, these little hand scrapers, because it's basically like this. It's a cheese grater. And all this is sharp pieces of metal that are scraping skin. If you have poor feeling, if you have diabetic neuropathy, you're not going to know if you go too deep. And even if you do have good feeling, it's very easy to tear your skin. You're much better off with a pumice stone or some type of a buffer that's not going to go too deep. The best time to do it is after the shower. You can do it in the shower, but please make sure you have something to sit on. Standing on one leg in the shower, trying to rub your feet, is a real recipe for disaster. Once you've gotten the dead skin off, it's time to moisturize. And there's a wide range of materials to use. The key ingredient is lanolin. Lanolin is the best thing that we find to try to bring moisture to your skin. If you have very, very thick, cracking, dry skin, the treatment to do is before you go to bed at night, you take some good cream and you put it onto your heel and put a good amount. You then take a plastic bag, like a vegetable bag from the supermarket, you put it over your foot, and then you take a sock and you put the sock over the plastic bag. And then you go to sleep. Why do you do it this way? This is called putting it under occlusion. It is going to make the foot warm, which opens up the sweat pores, which gets the cream in. You want to make sure you put a sock on because you don't want to try and walk on a plastic bag at 2 a.m. to the bathroom. Another recipe for disaster. You do this every day for 2 weeks. You will find your skin as soft as a baby's bottom. You can get rid of the socks. You can get rid of the bags. Just moisturize on a daily basis, and your skin should not crack, and you should be quite comfortable. For further information, please go on the websites of apma.org or American Diabetes Association, ADA.org, and of course, the weightofmyheart.org. This is Dr. David Alper. We'll see you again with another footnote soon.